know you probably had a little wine, you're eating your dinner, and I know what you want to hear from now is 3 members of Congress. But we promise you, yay, we are going to make this really good. I first want to thank Joe, and I got to tell you, he has been an incredible friend, a credible leader, of course, on patient safety, but also for medical innovation all over the country, all over the world. And my favorite Joe story is he had an event for me once at his home, and it was the next day after you had a little problem with your electricity in California. So all these people are out there. I'm giving this really nice speech, and the entire sprinkler system went out and drenched everyone on the lawn. And Joe is just taking it in stride like he always does. So thank you so much, Joe. I want to thank Congressman Paulsen, who I do so much work with. We are leading the effort to repeal the medical device tax. Okay, that's a good line you could use. And also, we've done a lot of work on a really important subject we won't talk about tonight, but sex trafficking, and trying to get some bills passed in Congress on that. Also, Congressman Rohrabacher, thank you so much for your leadership. I loved it. I Googled him so I would be all ready for this night, and his name was listed with mine as names that are hard to pronounce in Congress. And so we are a testament to the fact that you don't have to have an easy name to get elected, all right? And then my friend Dr. Carmona down there, who I'm sure many of you know as a former Surgeon General of the United States. Thank you so much for being here. So I do bring you greetings from the state of Minnesota, right? Where, in the words of our poet laureate Garrison Keillor, the women are strong, the men are good looking. Eric, that was your line, okay? And all the patient safety advocates are above average. It is truly wonderful to be here, and I was thinking, maybe Joe invited me because, we do a lot of medical device. I've done a lot on trying to get some sense into our medical system and also on patient safety. But I think he truly invited Erik and me because it's a little cold in Minnesota right now. And last year, this is true, there was a day, the weather, so you can check it out on the internet, because everything on the internet is true, but this is true, the Weather Service cataloged it. There was a day that it was colder in International Falls in Minnesota than it was on Mars. Okay, that's true, because the Range Rover was in this, it was on this really warm day in Mars. They were in a part of Mars like summering, and it actually registered colder in International Falls, so that's true. And it was also, I will say, fun to be here at President Clinton today. I thought he did a fantastic job. And what you should know, my first time I met President Clinton, I was actually the chief prosecutor, the county attorney in Minnesota's largest county, Minneapolis, 45 suburbs, in elected office, and I was invited out for this major event on the hate crimes bill, because I'd done a bunch of hate crimes prosecution, and I somehow, at the last minute, they decided that I would introduce the president, and I'd never even been on the White House, not even for a tour, and I'm standing outside of the East Room, right? And they have, Janet Reno is on one side, Bill Clinton is on the other. There's 500 people, all these cameras, because you're going to talk about this bill. And they have the military band, because they're making, and they start playing Hail to the Chief, do, 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 do. Yeah, so I start walking in, and this true story, he will verify this. I feel his big hand on my shoulder, and this voice says, I know you're going to do great out there, but when they play that song, I usually go first. True story. But you know what? That was my first official event in Washington, and my swearing in was my second. So there. Okay, so we have a little bit of serious things to talk about, and that is the incredible work that you're doing. And I think that the president, you've spent a day, many of you, hearing about the work that you're doing, hearing about the numbers. You have 200,000 people dying in American hospitals every year, errors that cost more than $17 billion each year, and we know that doesn't even include the pain and suffering of patients' families, and I know some of them are in this room with us today. But you're not just here for the numbers, right? You're here for the wife who lost the love of her life when doctors failed to take vital signs and misdiagnosed her husband's severe bacterial infection. Or you're here for the 19-year-old college student who collapsed and was diagnosed with a dangerous heart condition and told not to run, but he didn't remember that because he was on a drug that caused memory loss. There were no records, and he collapsed and died a mile into his last run. And you're here for the family whose young daughter was in the hospital healing from burns she'd received when she accidentally climbed into a tub of hot water. She was recovering, and then she got an infection, and she died days before she was supposed to go home from the hospital. So, what can we do about this? And I think the answer is right in this room. The federal government, of course, has a major role here in terms of setting the standards, in terms of putting the money into research. I've met a number of people here that have NIH grants that are doing great work in terms of developing the products that are going to prevent these kinds of errors and to take us all to reach that goal of 0 preventable deaths. The lowest, I got to tell you this, so I have so much faith that you guys are going to reach this goal because there's just a spirit, the fact that you have bipartisan support for this effort in Congress makes a big difference. And we have been through a lot in Washington the last few years, but I have this, I'm always positive. I have the seat that Hubert Humphrey once had, right? And he was the happy warrior. And I do see some promise in some of the words. I take our Republican leader in the Senate, Mitch McConnell, at his words when he says there's a difference between making a point and making a difference. And we have this opportunity now to make a difference, and especially in the area that you've devoted yourself to. And it has been a tough few years. I will tell you my lowest moment was the fiscal cliff vote, if any of you remember that. I know Eric remembers, and Dana, that weekend in the Senate, we were voting on New Year's Eve until 2 in the morning. And I will never forget that moment at midnight, right? Magic moment, New Year's Eve, midnight. I looked to my left, this is a true story, on the floor of the Senate. I see Harry Reid, I look to my right, I see Mitch McConnell, every girl's dream on New Year's Eve. That's where I was. But the good news out of this is that we came out of this. We were able, there was a lot of moderate Republicans that came up and said enough is enough of this. We had a group of 14 in the Senate that came together, Democrats and Republicans, and we were able, and I was in that group, and we were able to end that shutdown, and then we were able to go on there to get a budget and to make some changes, and it was positive. And if there's any area where there is, I think, a lot of agreement, that is on medical research and moving forward for high-quality care and low-cost care. One of the reasons Eric and I are here is because Minnesota believes in that kind of care. We are the home of the Mayo Clinic. I know there's some Mayo people that are out there, but they don't clap because we're Minnesota and we are very humble about what we do. We're home of the University of Minnesota. There have been countless studies showing that this model that we used in Minnesota, where we try to avoid having just multiple physicians see the same patient, we try to better coordinate care, that it works. And it can work well across the country, and that's what we are all about. But when I look at how we could help in Washington in terms of your efforts to get to the 0 death standard, I'd say the first is FDA oversight, and I think there's been some good changes at the FDA. With the help of the industry, we're able to pass MDUFA and PDUFA and do a much better job. What a name. For those of you who are just like had a few glasses of wine, you can laugh. But we were able to, with the industry's help, raise some fees and able to get a few more people looking at medical devices and get things approved. Both Eric and I were involved in those efforts, and I think it's a really important part of moving along these life-saving devices, moving along to save lives, moving them along because we know a lot of our competitors are in other countries, or people can get approval in Europe faster, and then they're going to be able to sell in China faster, and it's bad for the economy here in the U.S. So I think that kind of oversight from Congress and making sure the FDA is doing its job to get a lot of the work that you're doing approved is very important. The second step is something that Joe talked about when he was on the stage with President Clinton, and that's incentivizing quality care, paying for value. As you know, we did a number of things that the President talked about in the Affordable Care Act, including standards for reducing readmissions to hospitals. We have done some good work, and just actually yesterday, I got on a plane. We voted until midnight last night. Okay, so not all is perfect. So I came here with 4 hours sleep, but yesterday at some point in the afternoon, we met with Sylvia Burwell, the HHS secretary, with 4 senators about this point of encouraging quality care. And they're going to come out with some work next week that they've been doing, and some good news in terms of the effect of trying to, as we say, bend the cost curve. I think we've had the least increase in costs in 50 years this past year, and a lot of it, again, is due to the work in trying to get that higher quality care. And we've been pushing them to do even more of it, and we'll continue to do that. One of the leaders in the area is the National Quality Forum, and I've worked on a bipartisan basis with Pennsylvania Senator Pat Toomey to support that work. Joe mentioned transparency. I was listening to them talk at this stage and remembering back when you try to get that transparency, try to get that information out, try to get people to share medical records, how difficult it can be. And I was remembering back to my time as chief prosecutor when I tried to get all 45 of our police jurisdictions to file complaints on the same size paper. This is, in 1999, so that we could better get them into the computer and interconnect things and give them to we're talking about a county of 1 million people. I mean, we're talking about tens of thousands of cases every year, and everyone agreed to do it except one police department in a tiny suburb. So I drive out there myself, I meet with the chief, I'm like, come on now, why are you still using those legal size complaints instead of the regular size? Because we can get them for the whole county in the computer, all these homicides. He goes, County Attorney Klobuchar, I'm sorry, but we just bought some new file cabinets, and they are for this size. So I remember I got the state, somehow the public safety commissioner under Governor Pawlenty to help, and we got him new file cabinets, and then everyone was on board. So there's always a solution, but I think what I'm talking about, how different it is. And I guess the third and last area in which the federal government can take action to improve patient safety is through expanding access to medication therapy management. Again, I've talked to a few of you out there who are doing that right now. We know that medication mistakes can harm or they can kill. Research by the Institutes of Medicine found that drug errors are one of the most common medical mistakes, and at least 1.5 million people are harmed every single year. So there is a lot of work to do, and a lot of this is going to take measuring, and we know a little bit about how to do that at the Mayo Clinic and other places, but I am just so inspired by hearing today about your work and excited about what this holds for the future, and can't wait to bring it back to Washington. And Joe knows this, but I just got a new job as head of the steering committee at the Senate, which means I get to bring groups together to talk about issues and work to try to get legislation through. And I was sitting there today thinking, well, I think we need to have a patient safety steering committee hearing with all of the advocates and do something on that front. So thank you for everything you've done. Thank you for those 6,000 lives. When you think of it, 6,000 husbands and wives who are going to be able to celebrate another anniversary, 6,000 moms and dads who are going to be beaming with joy at their child's graduation. You're talking about real people. So my last story I'll end with is, if you ever come to DC, I invite you to my office. We have a Minnesota breakfast, and you're our friends, so you're invited. We always serve Minnesota food every Thursday morning, and if you're really lucky, you'll come the day we have Spam Puffs, which we do. Yeah, Spam is made in Minnesota. As Erik knows, it's Hormel. They're on the Iowa border, and they actually have a billboard that says, you are this many miles away from the Spam Museum, or the Guggenheim, as we call it. So, but when you come into my office, you will see a beautiful picture on the wall, and it's a drawing of a woman, and she's holding the planet Earth in her hand, and it's being handed to her, the world, by an angel. And the words on it read, "In my dream, the angel shrugged and said, if we fail this time, it will be a failure of imagination." And then she placed the world gently in the palm of my hand. So we are placing the world in the palm of your hand. And I know we will not fail, because there is such imagination in this room, and we just need a little more of it in Washington, D.C. Thank you very much.
Thank you so much, Senator Klobuchar. That was inspiring. And the steering committee for patient safety. Wow. Wow. Thank you. Thank you. I'd like to now ask one of our local congressmen, actually my district's congressman, who's been a big advocate for innovation, the intellectual property that protects innovation, and if anything, medicine is defined by innovation. So I'm really proud to welcome Congressman Rohrabacher. Please.
All right, you're in Orange County now. Okay, and I don't know how many of you actually come from this area, but I just want you to know that here I am, and we have a senator and a congressman here, a colleague, from Minnesota. And I just want to apologize to them that the weather is so bad here. And yes, we used to call it Minnesota. In fact, I used to work for Ronald Reagan. And Reagan, every time we'd come back to California on days like this, leaving Washington on the snow days like we just had, he would whisper in my ear, and he'd go, "Well, Dana, you know, if the Pilgrims would have landed here instead of on Plymouth Rock, the East Coast would still be uninhabited." So, hey, you guys can stay as long as you like, you know? So, you know, one of the things I did, I worked for Reagan for 7 years. I was a special assistant to the president, and I was one of his 5 principal speechwriters for 7 years in the White House. One of the things I did was that the president asked me, because of my calm and soft approach to the Soviet Union, that I should lead the first delegation of young political leaders where there was a freeze, and that I would lead the first delegation to the Soviet Union, and I would then, of course, you know, I'm representing the White House. So there I am in Russia in 1985, the height of the Cold War, and I studied what I'd be up against, and I was meeting their young political leaders. And we were at a Moscow bar one night discussing philosophy, very heavily, of course. And I had prepared myself to introduce them to the United States. And I knew what they did not have in Russia and the Soviet Union, and that is peanut butter. So I brought out this jar of Skippy peanut butter. Now remember, the Soviets had understood that this is totally useless in a society. Why should we bother to invest in the manufacture of peanut butter? So what they had done is created this image among people that Americans are eating all of this horrible stuff, and among the list was peanut butter, chewing gum, etc. So I said, would you like to really have a taste of what America's all about? Then a Skippy, and I go like this, and I went, just like this. Mm-hmm. And so it's like I was giving them cocaine or something, right? So little by little they go, oh, and there was, oh, peanut butter, oh, America must be so wonderful, you know. And that was true. The minute they tasted that peanut butter, they knew that all of this barrage of propaganda that they had about everything that we were eating and everything that we were doing in America was probably wrong, because peanut butter was really good. Well, let me note that after they tried the peanut butter, they all got in a little circle, and they were pointing to me, and one of them came over, who spoke perfect English, and said, we want to know what's on the side of the jar, those black marks on the side of the jar. And I said, oh, well, that's the barcode. And he goes, barcode? What is a barcode? And I said, well, that's why, that's in the United States. You like this jar of peanut butter. I go to the store, and when I get to the checkout counter, I go through the computer, and it itemizes my bill so I know how much that cost, and it notifies the inventory to order another jar of peanut butter. And that's the way we do it in the United States, and this barcode is what triggers the computer. He says, and then he went back, and they all came up, and he says, that's why we don't trust you Americans. You're always lying. You're trying to tell us you have computers in a food store? That's when I knew we were going to win the Cold War. But let me note this. What was it, really, what was going on? The Soviets were putting all of their money, they're putting all of their money into the military. The Soviets did have, motivated by their belief in Marxist Leninism, whatever, whatever you want to call it, they were going to push this on the rest of the world, or at least use that as a tool to dominate huge chunks of the world, or defeat Western democracies. Okay, they were putting all of their money in that, and they were not putting their money into computers that could be used in food processing and food distribution. They were not putting their money into health care. They were not putting their money into things that improved the lives of their people. All they were doing is putting money into those things that gave power to the state. And then they superimposed controls with a bureaucracy that strangled that population, who were ready when Ronald Reagan gave them this opportunity to jump out of that conflict in the Cold War and try to be our friends. Now, let me just say I've been very criticized lately because I don't want to go back to the Cold War, and I am deeply upset that we keep being pushed and pushed when it comes to, we're pushing Putin into a hostile position with the United States. Now, I know that's totally contrary to my Orange County friends, but there you go. I mean, we cannot afford another Cold War with what was Russia. We should be working with them, developing new technologies, working with them to make sure that we have a peaceful world by working together against those threats. Well, with that said, what we have now in our country instead is we are spending huge amounts of money on F-22s that sit on the runway. Billions of dollars for a weapon system that sits on a runway. And then we have superimposed a bureaucracy on the creative people in our society, and that includes the creative people in your industry. It's sinful. We do not need bureaucrats in Washington, D.C. telling doctors what they should or should not be doing with their patients. We should be instead encouraging the creative people all along the process to do as best as they can. Let's incentivize them. Let's make sure, and what have we done instead of incentivizing people? We're talking about survival here. We're talking about ending. You have so many thousands of people who are dying needlessly. Well, if we are going to have a higher survival rate among basically the most vulnerable Americans, we've got to make sure that the technological flow, the investment into it, and the utilization of it is not stymied by a bureaucracy in Washington, D.C. And let me just say, it didn't work with the Soviets, and it won't work with us. So this is more to me than just a philosophy, because I'll give you a thought. 2 years ago, my daughter was diagnosed with leukemia. My daughter is 10 years old. Now, it was a rough year 2 years ago. It was rough. But I know that because of what some of you out there have done, that leukemia among children has gone from 90% dead to 90% survival. And one of the things that has helped my daughter survive, you guys know more about this than I do, is a portal that they put under her skin, right here, my little girl, right there, and there's a little tube that goes into her veins, so that in the past, where kids had to get all of this, so many shots in their arms with chemotherapy, that their veins would collapse, now they don't collapse. Now my daughter's had it through that portal, and she is now in remission, I'm so happy to tell you. But I want to look up, and I plan to, this is on my to-do list, look and find out who it was that invented that. What company, what individual thought of that? And what company invested in it? And was that investment based on laws that encouraged investment into medical technology? Sure it was. I want to go and find that out. I want to find the person who did it, and I want to give him a big hug. And I want to give him a big thank you. But you know what our government has done to that person? It has made him the most heavily taxed person in this country. It is obscene that we are taxing people for medical devices who are saving those people who are the most vulnerable of all Americans. It is absolutely wrong, and we three are working on it, but we can... And finally, let me just note, it's not just one thing. One guy decided he was going to create a medical device. There had to be a profit incentive for him to do so. And if you tax him on his gross and he doesn't have that incentive, my daughter would probably be dead. Okay, if that was the policy all along. And all these other things that people are working on that can elongate life, that didn't exist, the barcode that didn't even exist for food in the Soviet Union, we could be just like that. We need to encourage the people, the creative people, and the investment community. We have to build laws that bring them together in order to commercialize and to put into play these new technologies that are available to us. One other thing and one other note. We need to free up and make sure that our people are free to look at the various options in order to keep down the cost. And I will just have to say that I am, I do come from Orange County, and I know you've heard some things that don't sound like Orange County now, but I am the point man in Congress to legalize the medical use of marijuana. And let me just say that I believe that people have a right to try these alternatives. Let people try the alternatives, for gosh sakes. It should not be up to our bureaucracy to protect people from themselves, especially those people who have perhaps been declared that they're terminal. This makes no sense at all. I'll give you, so let me leave you with that thought, that we in the United States, we don't enjoy all this wondrous freedom and all this wealth that we have. This was not just some, God on the other side of a cloud with lightning bolts saying, well, these are the people that we like. What's happened is our founding fathers put into our system a respect for intellectual property rights, for inventors, for innovators. Today, people who write songs, we just mentioned that. People who write songs have more protection and get more profit than someone who invents a machine that saves my daughter's life. That's wrong. We've got to get our priorities straight. We've got to make sure we're working together, give the people more freedom, not create more bureaucracy. And in this, I think we can succeed. God bless you. Thank you for letting me have my say tonight.
Okay, I noticed the chatter increased when you heard marijuana might get legalized. It hasn't yet, so please keep the chatter down. I'm grateful for Congressman Rohrabacher to come up. I know one of the things that has gone a little awry in our country is not being able to speak freely about different political point of views. It's that debate that causes the better political views, and we're lucky to have that ability, and we should foster that notion. I know that for us to have come together, focused on patient safety, many of us have very different views, but it's embracing everyone, even those with different views, and focused on doing right by our people is why we have succeeded, and I thank you all for that. So our next speaker, which we're very proud to have here, is Congressman Paulsen, Erik Paulsen. He has, since he's come into office, relentlessly he's tried to figure out ways to take any impedance out of the way of medical innovations and healthcare and we're grateful to have him in our Congress and grateful to have him here tonight. Congressman Erik Paulsen, please.
Well, good evening, and first of all, I want to thank both Joe Kiani and also Jim Bialik for their leadership and inviting me to be with you today, putting on a great event. It's fun for me to be with my friend Amy Klobuchar, who we actually both co-chair the House and the Senate Medical Technology Caucuses, so we get a chance to work on a lot of healthcare issues together, as well as a number of other issues, and I'm looking forward to getting that medical device repeal across the finish line this year, hopefully. And of course, Dana Rohrabacher, I mean, there's nobody in Congress that is more a strong advocate for empowering the innovator, for protecting patents, for knowing that protecting inventions is so critical. And I just want to follow up on his story about his daughter. And I'll share a story about Andy Marceau, because this is about patience. Andy was a college kid with a really bright future. He left Minnesota to study journalism at the University of Kansas. He was 3 weeks away from graduating and had a job waiting as a sports writer at the local paper. And then one day, literally, he felt a shudder up his spine. Now, Andy thought it was just the flu. What started as a fever and shivers, it quickly accelerated and turned into numbness throughout the body, a parched throat, and these ugly purple blotches on his arms. And within 24 hours, he ended up having to be rushed to the University Health Center and then to the hospital. And at age 22, Andy had never, ever suffered any major illness or injury. He didn't smoke. He was generally pretty healthy, took good care of himself, and that didn't stop him, though, from contracting meningitis B infection, Men-B. Now, Andy eventually developed sepsis and pneumonia. His lungs failed, and blisters that would burst and cause additional infections came all over his skin. He spent 141 days in the hospital, during which time he suffered very painful sessions of removing this decaying skin, and doctors had to amputate all of his digits except for his right thumb. Now, Andy contracted Men-B back in 2004, and he made it through this very horrific experience alive. But unfortunately, Emily Stillman did not. She wasn't so lucky. Emily was a college sophomore at the Kalamazoo College in Michigan. And one Friday morning, she called her mom, and she said, "I got this terrible headache." And by Sunday morning, that was on a Friday, on Sunday morning, Emily died of meningitis B. And that was just 2 years ago. Now, the circumstances that are surrounding Emily's death are actually particularly devastating and infuriating because her death was preventable. A lot of parents think their children are protected from meningitis since they remember them getting, the vaccine before they go off to college. They're protected for the rest of their lives. But actually, in the 10 years in between Andy Marceau's infection and Emily's death, these vaccines that have been developed for protection against Men-B exist, but no American citizens are permitted to get meningitis B vaccinations under our current government rules. Now, one meningitis B vaccine is called Bexsero. It's been approved in 34 other countries, the European Union and Canada, Australia, for a number of years. But I think a lack of leadership and too much bureaucracy at the Food and Drug Administration have actually left a lot of students and families in America now unprotected. And in the last 2 years, we've seen students that have been infected with this disease at Kalamazoo College, at Princeton, at the University of California, Santa Barbara, Georgetown, the University of Oregon, and also Drexel University. And some students have died, and a freshman lacrosse player up at the University of Santa Barbara had to have both feet amputated. And just 3 months ago, a student at San Diego State University died as well of meningitis B. Now, there are a lot of college students, a lot of high school students that have been infected or died, but because of privacy reasons, we don't even have access in media reports. It's not very widely reported. And as is with the case with so many of these drugs and medical devices, this glacial pace of approving them has really left us the ability to confront the problem. Very frustrating, I would argue unacceptable. And the good news is that today, this afternoon, the FDA finally approved Bexsero as a drug in the United States. Should also say, though, that because of other government red tape and regulations, it's probably going to be some time yet before it actually gets approved to get on the market and moves forward. And that's why parents like Alicia Stillman, that's Emily's mother, they've gone their own direction now in helping others get the vaccine. So now she's leading trips with hundreds of parents and children and doctors going to get the vaccination in Canada. In fact, I actually joined her this last August. I got vaccinated, so I'm protected. And we know it's safe, we know it works, and this fall the FDA also granted all students at Princeton the opportunity to get this vaccine, but they didn't make that available at other college campuses for some reason. And students and families, they shouldn't have to travel to a foreign country to get protected, right? So despite the fact I think we have all these medical breakthroughs and they're all made in the United States, it's interesting to note that a lot of Americans are often among the last to actually benefit due to the inaction or the regulatory bureaucracy that sometimes exists. And these are preventable deaths, which is your mission, which is what you're talking about, which is what you want to prevent. And we want to make sure we're continuing to bring together industry and all the regulators to streamline these processes, to work in partnership and ensure that patients ultimately are going to have access to all these innovative products. And I think this patient safety movement is started in the response to the fact that we have an increasing number of health care consumers in this country that need high quality health care. And despite all you've achieved, you think about the big numbers of folks that are still dying from preventable deaths. And it's not all about the FDA. There's a lot of factors that contribute to preventable deaths. You know, it's medical professionals that make the wrong decisions or they make mistakes. And other preventable deaths are actually the results of patients not taking care of themselves the way they should. We have to modernize our healthcare system so it's actually health care rather than just sick care, which is really important. And that means making sure we're empowering our patients and employees to actually take care of themselves. And Senator Klobuchar and I, we also are co-chairing and working together on other healthcare issues with the Wellness Caucus. And some of you might ask, you know, how did two Minnesotans get together from different parties and actually work on contentious issues of healthcare sometimes? It must be those long, cold winter nights and warm hot dish casseroles that brings Minnesotans together, I suppose. But one of the goals of the Wellness Caucus, I should tell you, is to showcase healthy lifestyles, employer wellness programs, everything that's working out in the market that really encourages employers to take better care of themselves. And many leading employers, they recognize this already. They know it's important to promote wellness for their employees, for their retirees, for those family members. It's not only good for business, it's the good right thing to do. And it also means a competitive advantage because a healthy workforce is also going to mean a healthy bottom line. And finally, I'll just say this, is that Americans also have an opportunity, those that live in more poorer or rural areas, to take advantage of getting healthcare access in different ways by using new tools like telemedicine. And we can really revolutionize healthcare delivery with these new tools of telemedicine. And now that we can digitize all these diagnostic tests, there's simply no reason to require many patients to actually travel where these doctors are, because the digital revolution is transforming banking and entertainment and education and publishing and every other walk of life. And we got to make sure we're using this technology to also revolutionize healthcare delivery as well, to lower costs and give folks a lot more access. So we've got a lot of work left to do, but I will just say that people in this room and that head up this organization and all the sponsors, they give us hope. They give me a lot of hope. And I think there's a big misconception in this country that some people think that everything important happens within a mile of the Washington Monument or a mile of the Rockefeller Center or the Hollywood sign. And the truth is, I would say that almost everything that is truly very, very important happens miles and miles from those places. And it's my conviction that, you know, America is never going to legislate or litigate or regulate our way to a better future, but we will invent and create and innovate our way to a better future. And that process of invention and innovation, it doesn't necessarily happen in big cities like Washington, D.C. or New York City. It happens in places like Irvine, California or Fridley, Minnesota, where entrepreneurs and doctors and engineers think of an idea in the backyard, they think of an idea in the garage, and they bring it forward because they know it's going to improve the lives of their fellow citizens and Americans. And California is a leader in healthcare delivery. Minnesota is a leader in healthcare innovation. And we need to make sure that these entrepreneurs are going to be able to breathe the free air of private enterprise, and making sure we're investing from the government perspective into medical research, and then we will see an improvement in healthcare quality and lower costs. And you've seen huge success going in a year from saving 60 lives to over 600 with 6,000. That's exciting stuff. And I know you're going to hit your goal by making sure by 2020, all preventable deaths, we will zero them out. And those of you in this room and all your friends around the country have a mission to embrace those innovations that we're all going to bring us a better life and support those employer wellness programs and empower patients so we can actually make progress. And as I mentioned before, Andy Marceau, that student, he suffered greatly. And we can't bring back Emily Stillman and those others who have died from meningitis B. But more enlightened public policy is absolutely going to save others from a similar fate. So I know that by taking action, working together, we will all make a difference. Thank you very much. Keep up the good work. Have a good night.